Hello and welcome to At the Heart of Health with Dr. James Marcum. In today's well-marketed world, it's hard to know who or even what to believe when it comes to health care. In each program, Dr. Marcum, a board-certified behavioral cardiologist, takes a balanced approach using common sense modern medicine and the ultimate source of truth, the Bible, recognizing that at the heart of health is love.
Today on At the Heart of Health, we're going to focus on a younger generation. Too many times we talk about diseases, heart attacks, strokes, cancer. Today we're going to talk about processes in the young. Heidi Bell is with us. She's a nurse practitioner. Heidi, tell us, what is a nurse practitioner? How can you help us? You look young and vibrant and healthy. What can you do to help this whole generation that might not be interested in their health?
Well, the important thing is to realize that health habits start when you're young, and the things that we do today are really going to affect us when we're older. So it's important to see your doctor regularly or nurse practitioner and be screened for those things that you might be at risk for, and start health habits early when you're young.
So you're telling me that the decisions you make now regarding your health might show up later?
Definitely do.
Well, that's interesting.
Yeah.
Now, you're young, you're healthy. Some people that might be watching this might not even think anything about their health, but I try to tell the young that what is your most valuable asset?
Your health.
Right. Well, you know, is it your house? Is it your job? It's your health. And a lot of people don't realize that in 20 years, we might be falling apart. And why are we falling apart? Things we do now. We've collected questions from literally all over the world. They've sent them into HeartWise Ministries. And we're going to ask some of these, and some of these we're going to know the answer to, some of them we aren't. And I thought you would be uniquely qualified because of two reasons. One is you're young, you can identify, you might be having some of these same issues, and you can share that with our viewing. And the young are the ones that don't watch health programming, and maybe they should. Because if we could get a whole generation to think healthy now, just think what would be happening in 20 or 30 years. We wouldn't have all these things about heart attacks and strokes. So our first question is from a mother of an 18-year-old. And she writes in, my 18-year-old daughter desperately wants a tattoo and body piercings. How would you approach this delicate issue? Of course, I do not want her to do this. Any suggestions? So here we have a daughter that's wanting a bunch of, you know, I've seen these piercings literally all over the body.
Yeah.
How would you address this?
Well, it's important to realize that what seems like a cool idea right now might turn into a source of regret later. So these things are meant to be permanent, and so you have to think about down the road how you're going to feel about having a tattoo. Certain risks to think about tattoos, such as skin infections, bloodborne diseases such as hepatitis B, C, HIV.
Now, do you get it from the tattoo ink, or where do you get the?
You can get it from if the instrument is infected with the blood of somebody who was infected. If it hasn't been sterilized properly, it's possible to get infected. So it's just important to know how they sterilize their tools. And skin infections. Those are quite common. Other problems, the tattoo inks aren't approved by the FDA because they're considered cosmetics. So the long-term effects are not really known.
So it's like squirting ink under your skin.
Yeah, it's like a sewing machine, just over and over again.
Wow.
So
infections aren't good. Does it hurt? I guess it hurts a little bit.
I've never had a tattoo, but I can imagine. I've been told that it's very painful.
Well, this is an interesting story that I had from someone that had a piercing, and she had a piercing in her tongue. And I don't see how you could eat with a piercing in your tongue, but she had a piercing in her tongue, and what happened is her tongue got infected, and lots of bacteria in the mouth, and the tongue got infected, the bacteria moved into the bloodstream, and it ended up landing on a heart valve, and at the age of 22, she had had an aortic valve replacement. That's a catastrophe. Well, anything else, you know, it sounds like this mother is wanting to convince her daughter not to do it. We talked about anything else that might be dangerous about piercings and tattoos.
Well, they're difficult to remove. If they do find out that they don't like it later on down the road, it's difficult to remove. There's 3 different ways to do it, but each of them has their risks and might not
What would you
work.
do, just sand off the tattoo?
Well, that is one way, dermabrasion. They numb the skin and sand off the top layers, and that can leave a scar.
Okay.
Or they can use laser therapy to lighten it over a course of several different times, and that may not remove it completely, or they can surgically remove it and sew up around where the tattoo was.
Now tell me, you're young and you think your health's your most valuable asset, but you're a healthcare provider. This is another thing of decisions we make in our youth come back to either bless us or haunt us later on.
Yeah.
So I would say that I think that the best point you made is you got to think about, what if you get a tattoo of someone's name on you? And you marry someone else?
Exactly.
Or, that would be terrible. So those are some suggestions. Let's move on to our next question, Heidi. Oh, this is a good one. I actually had some problems with this when I was a teenager. It says, I'm 14 years old, and this is written from a girl, and cannot control my acne. There are zits all over my face, and I'm very self-conscious. I could understand that. Yeah. Would you recommend to start with a prescription medication? So we have a 14-year-old, acne, self-conscious, zit medication, yes or no? What should they do?
Okay. Well, this is a very common problem in adolescents. It happens almost every adolescent at some point. About 15% request medical treatment for this. But, and it's caused by an increase in activity of the sebaceous glands, which produce oil. And this causes the follicles to become plugged, and it causes further oil production.
So our enemy here is oil.
Yeah, and then it also allows overgrowth of the bacteria.
Oh, and bacteria is our enemy too. So
exactly.
oil and bacteria.
So there's several things causing acne. And if you go and see a healthcare provider for this, they might recommend trying some over-the-counter medications such as benzoyl peroxide. This is available in different strengths. And it's a face wash, which has, you just wash your face twice a day, and it can take about 6 weeks to take effect.
Okay.
But this can cause some drying of the face. They sometimes prescribe topical antibiotics with this, or systemic antibiotics, depending on the type of acne that you have.
Yes.
And this decreases the bacterial count on the skin, as well as an anti-inflammatory.
Well, that's very good. Now, what place would you use an antibiotic, a systemic one for?
With the more pustular lesions. There's different type of lesions, like the open comedones, more commonly known as blackheads, or whiteheads are the closed ones. But some people have the pustular lesions that kind of are disfiguring at some point. So.
Now, I don't know the answer to this, but this was my approach when I was in adolescence. I used to pop those. Was that a good thing to do? Get the pus out? Because that was my thing. If it's not there, get the pus out. Everything's going to do okay. Is that a good thing to do?
Well, it can just open it up for introduction of more bacteria.
So it's not a good thing to do. Well, someone else told me it was my diet. Is diet related to acne, or do you just get it because of your hormones?
It's more of a hormone and oil issue. Diet change is not really indicated in this situation.
So it sounds like she needs to start with the non-prescription means first, and then if they're still having a problem, then go to a prescription medication. Okay, let's go to another question. Oh, this is a good one here. My friend is getting breast augmentation for graduation. My mom says this is very dangerous from a medical perspective. What do you think? And I'm not one that should be answering this one because I'm not a woman. What do you think about this, Heidi?
Okay. Well, breast implants, in and of themselves, they're not an incredibly risky, thing to get, but they do come with risks, definitely. It's a procedure that they have to have general anesthesia for. It takes a couple hours. You might have to spend the night in the hospital, but most people it's just an outpatient procedure. But it takes about 7 to 10 days to recover. And there are some significant risks, including dissatisfaction with results, interference with breastfeeding, maybe later on in life.
Oh, I know that.
Infections. Also, just it can. There's different types of breast implants, such as silicone and saline filled, and the silicone implants can have a silent rupture, and it's unknown. You won't know if it happens. Your doctor won't know if it happens. So you have to have frequent MRIs to make sure that everything's okay. Because if it does rupture, then your breast tissue can harden and calcify and cause lots of disfiguring and cause later surgeries down the road.
Now, a lot of people are getting these breast augmentations, and one of the questions I had is, let's say you get the augmentation, the risk of anesthesia and all this goes on. How long would a breast augmentation last, or when you're old, does it fall apart? You know, do you start sagging when you're old, or what happens?
Yeah, well, the studies aren't completely finished on these because they haven't been around for so long, but it's thought that they last from 10 to 15 years, and you should expect, if you get breast implants, to have future surgeries down the road.
So literally, if you got one when you're in high school years, if you had to have one every 10 years,
yeah, that's a lot of surgeries.
You get
and a
4
lot
or
of
5
money.
surgeries over the course of a lifetime. And then when you get really old, you know, what would you do then?
And insurance doesn't cover that.
Right. One of the things that I've noticed in my practice is women that have implants, they have a hard time getting echocardiograms. Those are sound wave pictures of the heart because the fluid gets in the way, so we can't even image the heart well because of these implants. Well, that's a very interesting issue. You know, we're going to have to go to break in just a minute here, but self-esteem also seems to be an issue. You want to know why you're getting it. Is it because all your friends are getting it, or that? We're going to come back after a short break and talk more about issues affecting the young. I think this is very important, and if you're sitting back there thinking this is not, or just think the health practices you get involved with at a young age are definitely going to affect your future. We're going to be back with Heidi Bell just after this brief break.